deputy clerk.
I don't know.
Yeah. I'll resurrect it.
And we can do it at council.
Yeah.
Sound check 1, ENCS.
Good thing my microphone was off. Okay, good afternoon. It is afternoon, right? Yes. Last night it was good, yeah. Okay, good afternoon and welcome to the meeting of the Emergency and Community Services Committee for April the 6th, 2023. We'd like to call the meeting to order. Please switch all electronic devices to a non-audible function during this meeting. And please note that quorum is present. And I appreciate the truncated introduction. Thank you very much. Are there any changes to the agenda, Madam Clerk?
Yes, Mr. Chair. Under delegation requests, we have added item 6.3, Mary Vaccaro, respecting the safer drug use space at the YWCA Hamilton, and the declarations of emergency. Under consent, we have 9.2, advisory committee minutes, the LGBTQ advisory committee minutes of February 21st, Hamilton Veterans Committee minutes of November 29, 2022, and February 28, 2023. And under general information, we have amendments to the outstanding business list.
Thank you very much, Madam Clerk. May I please have a mover and a seconder to approve the agenda as moved? Moved by Councillor Cretch, seconded by Councillor Nan. Any comments or questions about the agenda itself? Seeing none, we'll call the vote, please. That's okay. Yeah, we need music. Like the Jeopardy music. Vote is open. Thank you. Thank you. That vote carried. 7-0. Committee members, are there any declarations of interest today? Thank you. May I have a mover and a seconder to approve the minutes of March 23rd, 2023? Moved by Councillor Alex Wilson, seconded by Councillor Maureen Wilson. Is there any discussion on the approval of the minutes? Seeing none, we'll call the vote. Thank you. That was quick. And that vote carried 7-0. We have several delegation requests before us. I can't speak now. May I please have a mover and a seconder to approve the delegations as presented? Moved by Councillor Alex Wilson, seconded by Councillor Tammy Wang. Is there any discussion on the delegation requests? Seeing none, I'll call the vote, please. The vote's up. And that vote carried 7-0. I'd like to welcome our delegates to today's meeting. Our delegates are reminded that they have 5 minutes to speak. I'd also like to remind committee members that we have several delegations to hear on the matters before us before we complete today's agenda. Members are reminded that questions for the delegations are for clarification purposes only and not for debate. We will vote to receive all of the delegations in one vote. And we'll start with item 7.1. Hafiz Hussein, respecting the controls and verification process in the healthy and safe communities in administering the Ontario Works and ODSP program. This is a virtual presentation. Mr. Hussein, are you here?
I am, Chair. I'm calling in on WebEx. Can you hear my audio?
Yes, I can hear you. The last time you appeared, we asked you to turn off your video because your voice was cracking up. So if you want to try it with straight audio, does that make sense?
Yep. I just made sure it was straight audio because I'm just calling it to make sure that it didn't happen from yesterday.
Yep, perfect. You have 5 minutes, sir, and it will begin when you begin speaking. And just like yesterday, just relax. You're amongst friends, so just give your best.
Okay, great. No, thank you, everyone, and thank you for taking the time this afternoon. The reason I wanted to bring this matter up to this committee was in regards to ensuring that taxpayers' dollars are that there's proper controls and verifications in place in order to verify and administer certain benefits that the province has put onto municipalities. One thing in particular, which there's not to be much oversight on, is administering the Ontario Works benefits when it comes to validating if information that is provided in either applications is correct and that it gets validated. Where I'm coming from this is the first part is verifying information that is provided at a place of address. If an Ontario Works or Ontario Disability Support Program recipient provides at a place of residence, and claiming like the rent or sort of housing benefits. Not sure how this municipality administers the program on behalf of the province, but wanted to see from a general issues standpoint, as well as for this committee, if there's proper controls in place to ensure that the application, that the recipient, I do respect that there's privacy concerns or anything, that the information gets validated by city employees in a matter that integrity, fairness, and protecting the taxpayers' dollars. And so my use case for the first example is if a recipient from Ontario Works or ODSP applies for a benefit, they have to A, verify themselves that they're a resident for the municipality of Hamilton, and B, once they provide proof of residency, it could be form of there's a certain form that I found on the City of Hamilton website, like a landlord verification form, or a lease that's provided that's in there. Does the city, does the department officials that work in this area, I'm not sure which department or social services, validate that with city records? So either the tax roll or MPAC assessment to verify that the recipient who is applying for these benefits, that the actual lease or document from the landlord is checked under information that the city has in other departments, such as the MPAC tax registry or the tax system, as well as the billing that is done for the water bill to make sure that the actual address and name matches. And so I was bringing this issue up to the community, to this committee, to see if there's controls or checks and balances to ensure that that information is validated to protect integrity and as well as to reduce fraud and waste. I did bring this matter up to the city auditor to investigate it, but I also wanted to bring this up to this committee as well. The other issue that I have is in regards to if residents that are recipients of these programs are coming up to financial hardship. There's programs that the municipality offers, such as rent support, as well as support in regards to providing hydro and gas reimbursements or grants, as well as if the tenant is responsible for payment of the water bill, does the municipality offer those sort of rebates or sort of grants directly to recipients so that they could forward it off to, I'm not sure who the hydro provider is in this municipality, or to like Consumers Gas or Enbridge, or to Electra for water. Wanted to see those controls as well, if there's A, verification, or B, if tenants are responsible for paying for the water, but how the municipality has a bylaw that the water bill is in the landlord's name, that A, does the funds go directly to the recipient so that they then forward it over to Electra for water, even though the water bill's in the property owner's name? Or how is there controls in place to ensure that if funding or grants are provided for individuals that are in financial hardship, such as rent or support for hydro or water bills or gas bills, like those basic necessities of life, how do we ensure that it gets to the rightful areas? So that's my two issues for this community. It's just, as a resident and taxpayers, the municipality is at the forefront of administering a lot of these programs. And I also know if there is a grant provided, like I think recently the Ontario High Energy Board provided additional support for hydro grants. So I'm not sure if those programs, such as the hydro rebates, are promoted to residents that are in financial hardship of hydro. I don't know in this municipality if hydro is under the municipality or if it's Electra that does the utilities for both hydro and water in Hamilton. But just wanted to bring these two types into these issues as a taxpayer, ensuring that if grants or support are provided for recipients that are in need for financial support, that they get to the rightful areas, and that controls are in place to ensure that it is given to individuals that are in rightful needs, and that we validate and control that as well. And then if financial support is given for water, like if like the recipient is responsible for water, even though the water bill is on the property owner's name due to the bylaw in this municipality, that does this department give the funds directly to the recipient, then that then forwards it over to the property owner, then that sends it back to Electra. I'm not sure how that process works for those controls, but it is a general concern of mine, given that the need for hardship is growing due to the current economic situation. However, taxpayer dollars needs to have checks and balances, and ensuring that the funds are given to the correct areas at the correct time, and that there's oversight and controls and verification of eligibility. That the city does have this information
Thank
and
you,
does.
Mr. Hussein. You are a little over a minute past your time limit. You've raised some very valid points. I can tell you that the compliance audits, if you will, that get conducted every so often, everything is required through provincial legislation. So there are regulations and policies from the province that indicates how the city will conduct those types of audits and how the grants are going to be accounted for any resident who is receiving ODSP or Ontario Works. So I hope that allays some of your fear. There is that type of research to ensure, as you say, taxpayer accountability. So I want to thank you for appearing today. I really appreciate your comments today. Okay?
Okay, thank you.
Thank you. Have a wonderful day. Okay, our next guest is 7.2. This will be an in-person delegation, and it's Mary Vaccaro. I might have mispronounced it. Respecting the safer drug use space at the YWCA Hamilton and the declarations of emergency. My apology if I mispronounced your last name.
Thank you so much. My name is Mary Vaccaro. I'm a faculty member in the School of Social Work at McMaster University and oversee research and program development for the safer drug use space at YWCA Hamilton. So as this committee decides on whether or not to declare a state of emergency relating to the drug crisis, I just want to share a bit about our program and what we're seeing. So we know that there's been an exponential rise in opioid-related EMS calls. From January 1st, 2023 to March 26th, 2023, Hamilton Paramedic Services have responded to 237 instances related to suspected opioid overdose. Prior to opening our safer drug use space at YWCA Hamilton, we were calling paramedic services for suspected overdoses between 5 to 7 times per week. This was the basis of our exemption as we operate an urgent public health needs site. The safer drug use space at the Y was developed as a direct response to the drug poisoning crisis impacting women, trans, and non-binary people experiencing homelessness. And we do this through a partnership with Keeping Six and Hamilton Social Medicine Response Team. So we operate an integrated model of safe consumption services in a space that's already responding and seeing multiple overdoses and poisonings. We operate overnight when all other services and programs that support people who use drugs are closed. And we're a gender-specific program that offers trauma-informed supports, recognizing the link between gender-based violence and substance use. In addition to safe consumption, we offer coordinated care pathways to support people who wish to access detox, treatment, opioid agnostic therapies, and a safer supply. So we are operating under an urgent public health needs site, which is an exemption provided to us by the Office of Controlled Drugs and Substances in Health Canada. We provide clean harm reduction supplies, naloxone and naloxone training, and a safe place to use substances and be monitored after use. And we serve women and non-binary people who experience street-level homelessness, who are accessing the Carol Ann's Place program at YWCA Hamilton, and those who are living in our transitional living program. Like I said, we operate overnight from 10 p.m. till 9 a.m. We do so under a medical directive that's provided to us by Dr. Claire Bodkin through her capacity as a physician with the Hamilton Social Medicine Response Team. And we employ people with lived experience of substance use as peer support workers in a partnership with Keeping Six. And we're a point of connection for many women who have barriers to accessing traditional health and social services. We opened our program on April 23rd of last year, and since then we've seen 203 unique guests since opening day. So this is people that are staying with us at Carol Ann's Place in our transitional living program and those who are living outside. We average about 16 visitors per evening, but we can see up to 25 people a night. And reasons for visiting include supervised consumption, be monitored after smoking, to access harm reduction supplies, to access naloxone and naloxone training, and to get referrals to healthcare services, detox, and other supports. Since opening, we have made 0 calls to paramedics, and we have made 0 calls to police. The intent and purpose of our safer drug use space was to save lives, and we've done just that. We've saved the lives of 53 women and non-binary people who had drug poisonings and overdoses in our space since we opened. What we really believe is that there's a community-based response needed to the opioid epidemic. Our process before opening our safer drug use space was that there would be a suspected overdose or a drug poisoning in our program. Our frontline staff would respond, and they would call 911. The person would then be taken to the emergency room by paramedics, oftentimes paramedics sitting with them in the emergency room for a long period of time. Our current response, there's a suspected overdose or drug poisoning that occurs in our space. Our harm reduction workers respond using oxygen, using an SAT monitor, and when necessary, naloxone, and that person is monitored and supported in our space. And since opening, we've made 0 911 calls, 0 people have been transferred to the emergency room, and we've had 0 deaths. This really is a made in Hamilton approach, an approach that's getting attention on a national level. And our intention has been to develop and pilot an innovative model of providing life-saving services that can be replicated by other shelter providers locally and across Canada. Our work has been shared by the Canadian Drug Policy Coalition at Simon Fraser University, by the Canadian Observatory on Homelessness, with a webinar with Women's National Housing and Homelessness Network, providing information to other gender-specific shelters, and it will be featured in a book chapter in a forthcoming book entitled Pandemic Planning and Homelessness, Lessons from COVID-19. So that's the end of my presentation, and thank you so much for having me.
Thank you for appearing today. Committee members, are there any questions for our delegate? Councillor Wang, please.
Thank you. 3.
Oh, sorry. Councillor Kretschmann first. My apologies.
No worries.
No preference in line up there. Sorry, I was just pointing to the speakers list there that's already started. Thanks. Yeah, I really appreciate you coming here and talking about this. A few of us had the opportunity to meet with you and chat about this in advance, and so we're already hip, and I've been saying for a while that there's been no deaths, but a thing I haven't been emphasizing, so I want you to comment more on it, was that there are no calls to 911. There are no calls for emergency dispatch, and I think what you were saying, if I understand, is that, look, like there's that time we always have where the paramedic is waiting with the person in the hospital space, and that time is also gone as a result of this. My question. So thank you for all the work you're doing. This is in Ward 2, so right near where I live. So I see the impacts every day. What does it mean to everyone there to have this kind of transformative program? Like, what has it meant to the lives of the people who are there that you see every day?
Thank you so much for the question. I think it means it's really shifted the ways that we deliver services at YWCA Hamilton. We've been able to support people in more transparent and authentic ways about regarding their substance use. And, you know, we're really starting to build connections with women and non-binary people who use drugs and who, for many reasons, have felt that excluded from health and social services, who have felt barriers to accessing healthcare. We've seen referrals to healthcare providers for women who haven't seen doctors in years. We've gotten people into detox because of the connections that they've made through coming to the space every night and just having the opportunity to have open conversations with people who support them around their substance use. I'll also say one more thing. It's been transformative for the staff who work at YWCA Hamilton because it takes a lot of the pressure off in terms of having to respond to opioid overdoses during your shift in all parts of the building and outside by containing it into this one room and having sort of a system to make to do a community-based response when there is a drug poisoning. It takes the pressure off, it prevents staff burnout, and as I said, it saves lives.
Councillor?
Thank you. One thing we heard about when we had other shelter providers come and talk to us was that a very hard thing right now is trying to find folks to do this work. So trying to find folks who are going to be in these harm reduction safer spaces, safe use spaces is not easy to do. And so I imagine that it being an improvement for staff makes a big difference. Could you speak to that more though, about that kind of, have you seen better retention, more folks sticking around? Have you found a more holistic approach to staff? How does it all work with your staff in light of all these changes? And could you also just highlight how long this has been going on for? You might have said so, but I just missed it.
Thank you. Mary, go ahead.
Thank you. So we opened April 23rd of last year. We have many of the same staff team that opened up with us, still supporting us to this day. Some have moved on to other opportunities and to education. But I think it supports staff across the YWCA programs because it takes the pressure off. So I am connected more so to the university, so I can't speak to staff retention across their programs, but I can say anecdotally that this is improving the day-to-day conditions of the workers because it takes a bit of pressure off in terms of having the worry around responding to overdoses in the bathroom and in all sorts of spaces in the program.
Councillor.
Thank you. My last question is about expansion. So this is great. This pilot is amazing. Like, I just can't, I talk about it with everybody I speak to, how important it is and the lives it saved. What are the barriers to expanding this across the city so we can start seeing this helping folks everywhere, not just in Ward 2?
Thank you. Mary, please.
Thank you so much. So we are hoping and eager to work with other shelter providers and other service providers to support expansion. We've developed sort of a toolkit that walks service providers through how we did the exemption application, our policies, our day-to-day program, our day-to-day sort of operational policies that we would be happy to share. And yeah, just eager to see this pilot be expanded in other shelters locally and across Canada, and we're sharing the work in both spheres.
Councillor? That's it. Thank you very much, Councillor. Next speaker is Councillor Alex Wilson. Sorry.
Thanks, and through you, Chair. Thank you so much, Mary, for coming out, and again, like, really appreciate following up on these discussions. I think it's worth reiterating the point that there's not just lives saved, but there's a amount of time, money, resources when we're responding to things in community, responding to things proactively, as opposed to using emergency services as our primary response to drug use and substance use. So thank you for yet again making that point really, really clear. A question I have for you, following along Councillor Kretsch's line of scaling up and expanding, is how do you see the forthcoming Hamilton Drug Strategy review or the Hamilton Drug Strategy itself as a vehicle to some of this work? I know you mentioned that the YW is interested in being a model or acting as kind of a mentor to other groups interested in this work. How do you see that kind of working within the Hamilton Drug Strategy and that broader ecosystem?
Thank you so much for thank you so much for the question. I think what we really want to see is in integrated safer drug use spaces, right? It's great to have standalone community consumption and treatment services, but that requires that people leave where they're at, where they live, to go and use. And so we know that integrated models work. We know that since opening day, we've been busy serving people that already live at or access programs at the YWCA. So my hope is that the drug strategy can focus a little bit on integrated models, particularly in the spaces and places in Hamilton where we know opioid drug poisonings and overdoses are happening frequently.
Councillor?
Thank you, and through you, Chair, later today we're discussing a declaration of emergency. A big part of that is, and I'll let the mover, Councillor Clark, but I think a big part of that is provincial advocacy and getting the province to take this seriously, understanding that it's going to take a whole community approach, including what you're showing us here. When we think of funding, whether that's municipal funding, provincial funding, federal funding, grant funding, where it comes from, what would that do to expand this program, or how does funding fit into this expansion of these services?
Good question. Mary?
Thank you so much. So we're currently supported by Hamilton Community Foundation, as well as we have had some support from the Canadian Women's Foundation. We are actively searching for funding at the provincial and federal level. We believe it's a healthcare issue, a provincial issue. So again, we're hoping to see that this is an emergency, and like I've said, there is community-based responses to this that can alleviate the pressures on an already strained healthcare system.
Thank you so much, and through you, Chair, just seeking confirmation, what is the operating cost for the year that you've done so far? Understanding that a different model may have different costs, but just you're the anecdote we have. Roughly, what is your kind of 1 year of operation costs?
Mary?
Thank you so much. So because we're just sort of wrapping up our full year, it's hard to say. We're looking, it's been about $400,000. That includes our safe supply clinic that we operate in collaboration with HamSmart, that's funded right now through SUOP. So it's funded through a federal Health Canada grant. So we need to understand more what it takes to offer the integrated safe supply model, but our continuum of services, the safe supply clinic and the safe supply or the safer drug use space, is about $400,000. And just to say, that's also with us only operating 12 hours a day.
Councillor?
Thank you, and through you, Chair, last line of questioning from me is about the added value, not just in terms of when we're thinking about frontline services, but there's jobs being created here in the peer-to-peer network. I got a lot of my work in political advocacy from peer-to-peer in the mental health sector, and that's where I started kind of doing some of this stuff. And I found it really life-changing in terms of those types of experiences, how you engage and what that leads to in the future, and how you kind of become an advocate, but also part of community personally. Could you touch on what that peer-to-peer program is like in your space and why you think that's the way to go?
Mary, please.
Absolutely. Thank you so much. So through our partnership with HamSmart and Keeping Six, we've been able to hire peer support workers. Those are women with lived or living experience of substance use who are a part of the community that we serve. They receive training from Keeping Six and HamSmart and work alongside harm reduction workers in our space. It's been transformational. It's helped us to build trust. It's helped us to shift our program from being sort of a clinical or model to more of a community-based model that really was created in a way that aligned with the visions of women who use drugs in our community. And our peer support, so we've been able to publish sort of a handbook for other safer consumption sites, which will be published soon around best practices for working with peers in safe consumption sites from a gender framework.
Councillor?
Thank you so much to the chair and to the delegate. I think this is really useful information, and I hope that we continue hearing about the successes that you are having and we can act on that.
Thank you so much.
Councillor Wang now, please.
Alex Wilson asked all my questions, asked and answered.
Thank you, Councillor. Councillor Tom Jackson.
I really enjoy the way you say that, Chair Clark. Thank you. Mary, nice to see you. I want to say that I'm not, I think the community I represent on the East Mountain by majority, their views on the opioid crisis and familiarity with it is probably reflected through their ward councillor in that we're not as close to it as some others are around this horseshoe and in the community, and where the concentration might be. So all that I'm saying it as an opening and preamble, Chair Clark, through you to Mary, I'm incredibly impressed of all the presentations, delegations that have appeared recently, speaking to safe injection sites, consumption treatment sites, different programs that are needed in the community. I'm incredibly impressed with your presentation, obviously your outcomes. So my question through you, Chair Clark, is how did you begin, and your group of primarily women or others on your team, how did you begin approaching this issue that led to this success? And I'm not pitting one against the other in terms of all the great work in the community by other advocacy groups and organizations, but I'm just incredibly impressed with your success story that you're telling up to now. Through you, Chair Clark, please.
Thank you, Councillor. Mary, please.
Thank you so much. So I think what we did was a little bit different in terms of our application was under an urgent public health needs site opposed to a consumption treatment service. So in order to apply for an urgent public health needs site, what we had to do was demonstrate to Health Canada that what was happening in our building was an urgent public health need. Unfortunately, that was easy to do because we were having so many overdoses, so many responses from paramedics in our building. And so through doing that, we were able to expedite the exemption process by demonstrating, A, that this wasn't a new program coming into community, it would be an integrated model into an existing program, and B, that it was a response to what was becoming an urgent public health need. And we needed to do this in a quick way. So yeah, we began the process we opened in April of 2022, so I believe we started getting everything organized really in September of 2021, putting the application together, partnering with HamSmart, and yeah, got approved in January and got up and running in April. Thank you so much.
Outstanding. And even your moniker of Safer Drug Use Space, totally different name for the place that you want people to come to. Again, was that a deliberate decision on having a different title, if you will, for the location through you, Chair Clark?
Thank you, Councillor. Mary, please.
Yes, so because we have an exemption that's an urgent public health needs site, we can't call ourselves a safe consumption and treatment service because we don't have that special exemption from the federal government. So we are a safer drug use space, and the name I think fits. So yeah.
Wonderful.
Councillor.
sincere congratulations on the lives you have saved, and this you have my full support on the model that you wish to put forward throughout in our community in terms of moving forward. Thank you, Chair Clark.
Thank you so much.
Thank you. Councillor Wang, if you can take the chair for a second, please.
Go ahead.
Mary, I do want to thank you for coming in today. But two things. One, to thank you and all of your colleagues and the work that they do. It is, I'm sure it's tremendously gratifying to save lives in the manner, but it's equally very challenging. And I'm thrilled to hear that you've had success with many of your clients who decide to go the rehab route, the detox route. From my understanding and experience, it's the relationship that they develop with people like yourself that helps them make that decision to move forward. It's very challenging for someone to make that decision to go into rehab on their own. So kudos for your team there. I also, I want to thank you for your comments with regards to the motion that we're going to be dealing with later today. And it's been challenging trying to get, and you know this, I know you know this, to get the provincial government and not so much the federal government, because they do have some programs that are helping us, but for some reason, the province has kind of dropped the ball. Whether it's intentionally or not is irrelevant. The fact is that this crisis has grown to be an emergency over the last year and a half, and we're seeing far too many deaths as a result of overdose, but also as a result of drug poisoning. The stuff that they're getting on the street has stuff in it that nobody should be injecting into the veins or smoking, and they're doing it many times out of an act of desperation. So the fact that you have a program where they can do it in front of you and you can monitor them, or you and your colleagues can monitor them at the Y is tremendous. So I really don't have questions for you. I just have admiration for you. So thank you very much for everything that you're doing.
Thank you so much.
God bless you.
Thank you.
Thank you, Mary. Back to you, Chair.
Thank you very much. You're welcome to
Thank you so much.
stay for the rest of the meeting, although sometimes it's pretty boring. Sometimes it gets pretty exciting. I'm sorry. I'm just saying the truth. Okay. So I need a motion to receive both of the delegations. Moved by Councillor Alex Wilson, seconded by Councillor Kretsch, and we'll have that vote, please, Madam Clerk. Oh, there it is. Would you happen to have tissue there somewhere, please, and thank you. Oh, I don't need both of you to jump. Thank you very much. Okay, we're now moving on to item 8.1, the Community Safety and Wellbeing Plan Annual Report, which is HSC 23015 citywide. Rochelle Ihakrova, Manager of the Community Strategy, and Kubra Hagar, the Co-Chair of the Community Safety and Wellbeing System Leadership Table, are here for the presentation and report. Welcome, both of you. I hope I did okay with your names.
Thank you, Chair. We're very close. Rochelle Ihekwoba.
Thank you.
Very close, though. Thank you for having us.
Thank you.
We got our presentation. Thank you. I'm Rochelle Ihekwoba, Manager of Community Strategies here at the City of Hamilton within our Healthy and Safe Communities Department, and joined by...
Hello, everyone. I'm Kubra Hagar. I'm the Manager of Programs at the Hamilton Center for Civic Inclusion and co-chair of this committee.
So we're really happy to be here today. As Kubra mentioned, we're co-chairs of the System Leadership Table. We've provided to you an annual report on our Community Safety and Wellbeing Plan. There's lots of great work underway, and we wanted to walk you through that a little bit, provide some updates, and discuss some of the next steps for the plan. So the work began in 2018 when the Safer Ontario's Act was passed, and from there all municipalities across the province were tasked with putting together a community safety and well-being plan. The work in Hamilton started shortly after that in 2019, where we brought together many community partners, residents, data to understand what are some of the most pressing issues that Hamilton's challenged with when we speak to safety and well-being. And so from that consultation, we came up with 6 priorities. We'll speak to that in a minute. And in June of 2021, our Hamilton City Council unanimously adopted our Hamilton Community Safety and Wellbeing Plan. From there, we've been working to really facilitate and convene different groups across the city to understand what is the current work that's happening supporting safety and well-being, because there is many, and how do we understand what the gaps and opportunities are as we move this work forward. When we talk about community safety and well-being, the overall goal is really so that we can achieve that ideal state of the community where people feel safe and are thriving and have access to services in education, healthcare, in many different areas. And so it is a broad goal, but it is one that we know that not one organization could tackle, but many. And so that's where we knew we needed an advisory committee, and that's referred to as our system leadership table. On the screen here, you'll see all the different organizations that are represented at that table. There's 17 agencies from education, healthcare, policing, community services. And within the city of Hamilton, we have a few different divisions that sit at the table as well. Children's and community services, housing services, and public health services are also there as well. So just wanted to note that we have many partners that have come together to put together this plan, and we continue to work with them, and we appreciate their commitment to this work. Now, I mentioned the early days of the plan. We came up with 6 key priorities that this plan would focus on, and that includes access to income, violence, hate instances, substance use, mental health and stigma, and housing and homelessness. And you can see on the left part of the slide here that there's a community safety and well-being framework that we're working within. And so when we're looking at the solutions to address the priorities, it's really within this framework. Social development, looking at how do we promote and maintain community safety and well-being, prevention, how do we take a proactive approach to the needs in the community, risk intervention, and incident response. And locally, where possible, we are focusing more on the upstream preventative strategies and initiatives. To date, we've really played the role of trying to build the relationships with so many of the service providers doing this great work, and we made sure that we really took the approach that we weren't duplicating, that we were really being mindful of the great work that's happening and making additional connections or identifying where those gaps might be and how do we support that work going forward. And so, yes, I think really within the city of Hamilton, there's just a few plans that we wanted to highlight that we've connected into or building off of, and those include our Housing and Homelessness Action Plan, our Youth Strategy, Urban Indigenous Strategy, and our Hamilton Drug Strategy as well. Over to you.
Awesome. So as Rochelle mentioned, there are a couple of highlights. I just saw the slides are doing something kind of funny there. There you go. All right. So we did highlight some initiatives that were taken up by the Community Safety Wellbeing Plan Leadership Table in 2022-2023. So the first one was the development of a Community Safety Wellbeing Evaluation Framework, and this was done in collaboration with the McMaster Office of Community Engagement. And this framework is hopefully going to help us evaluate the implementation of the plan, as well as the outcomes that come out of the priorities that we've highlighted. And another objective, of course, is to support equitable and evidence-based and accountable decision-making from the processes that we go forward with. As well, we participated in the Inter-Regional Community Safety Wellbeing Plan Greater Toronto and Hamilton areas meeting. So it was a forum, a symposium with over 140 organizations represented, 250 participants. And during this meeting, we had the chance to discuss with over 30 municipality representatives with the goal of course, raising awareness about the Community Safety Wellbeing Plan and the importance of implementing such an initiative in each municipality. Whoops. Okay, all right. So we've also been partnering with the City Lab at McMaster, and hopefully this is going to be finishing up very, very soon, but to develop a community safety wellbeing system mapping initiative or a system mapping program where we're looking at how these organizations and collaborative tables in Hamilton interconnect, intersect, relate, and act together in such a complex system. As well, we already sent out a survey, and I think that survey closes today, if I'm not mistaken, to community tables, to local organizations, committees, and coalitions to collect necessary information about how to create this map. And then, of course, we will share the outcome of this once it's been completed. As well, there's been a lot of discussion around how to address safety concerns in the McWeston neighborhood. Of course, community members have identified the need to respond to neighborhood safety concerns in the area, and so we've partnered with community along with the services in that area to address those concerns and also talk about what role the youth have to play in that conversation. We've played a convener role and brought together multiple partners to the table to talk about how we can address the issue. And of course, right now the focus is how to build a relationship with youth, connecting with them and addressing this issue so they become aware and involved in the programming that is going to be offered to them as well. And just a side note that there will be a bowling event coming up this weekend where the youth engagers from the City of Hamilton, as well as some other community partners will be able to engage with the youth there and have some chats as well. So hopefully that's happening over the weekend, and I think that will be quite fun. So the other highlights that I would like to bring forward is, for example, the Building Safer Communities Fund, which was a community-led initiative. Initiatives that were aimed at reducing and preventing youth violence. And so the first kind of cohort of funding for this had already went out back in the fall, and we're currently just waiting on the results that have come out of that, but I think that will be very soon as well. And these community groups led different programming and initiatives to talk about how to reduce and prevent violence in the community with the youth. And of course, this was very much so community driven, and this is part of the $4 million funding that we received over 4 years to implement this community-driven response by the federal government. And so we are hoping, of course, to see what the recommendations come out the recommendations that will be coming out of this report as well, and presenting that to council. And of course, these initiatives are very much so trauma-informed and healing-centered, as well as community-led. So it's great to see that. And lastly, in the highlights, I did want to mention how we've been partnering in the City of Hamilton and around the table to prevent hate in Hamilton. And one of the examples that we want to highlight is the online hate reporting tool that, it is a collaboration between the Hamilton Anti-Racism Resource Center, HCCI, and of course, Dr. Emil Joseph at McMaster University. And hopefully this online tool can, allow us to collect more data on what it looks like on the ground and what community members are facing when it comes to hate incidents, and how we can best support them through those incidences as well. And of course, we're also members of the Hamilton Inclusion Campaign Steering Committee and No Hate in the Hammer. And the steering committee of the Hamilton Inclusion Campaign is being led by HIPSI right now, so that's also great. And of course, this is a long-term initiative. The Hamilton inclusion campaign it started back in 2017, and it's kind of relaunching right now in 2023, hopefully launched by the fall month, the spring month. So I would say late April, probably beginning of May. And then hopefully that can be a long-term commitment that we are also a part of. And I also wanted to highlight our community partner workshop, which took place back in November, where we had over 110 organizations who participated, and this was just happening across the street. Multiple sectors were represented during this meeting as well. We had education, housing, mental health services, employment, youth services, of course, and other sectors who were represented as well. And, you know, we had the chance to discuss how to engage each other and, you know, partners around the table to identify and prioritize the community safety well-being initiatives and how we can work together to implement them this year and next year and the years to come. I think there were a lot of commitments made by community partners on how we can collaborate and work together in this regard, and it was great to be able to prioritize that together as well. And so on this slide, we have some of the recommended initiatives for 2023 that came out of these discussions that we had with community partners. And so the top three that did come out of this was the implementation of a situation table in Hamilton. And for those who aren't familiar with the situation table, it basically brings together different community stakeholders to respond to a specific individual crisis incident or an individual who is undergoing a tough situation, and bringing together these community partners to discuss how to best support them and offer wraparound supports in this situation as well. The other focus is to enhance community-driven solutions to community safety and well-being plan, or community safety and well-being. And I think in thinking about that, and what came up a lot is just knowing that a lot of the priority areas that we've identified are already areas that are being worked on by different community groups and different organizations across the city of Hamilton. You know, there's the constant conversation around how these community groups are very underfunded, and I think enhancing these community groups and organizations that are already doing the work is a big priority as well. And then the last of the current focuses, or more specific focuses, is developing a community safety well-being data strategy. And I think this has already started with the partnership with McMaster students. But, you know, determining what we should be measuring to show the impact of the community safety well-being plan is necessary, and also seeing how the collaboration is effective is part of that as well. So for further exploration, the three other priorities or initiatives that were identified that can be worked on, but they still, I would say, need some more conversations around how we can most effectively do this, are to improve and expand affordable housing options and supports, of course, strengthening homelessness supports through collaboration, shelter improvements, and reduction of barriers to access, and then as well advocating for a living wage and basic income. And of course, these conversations are already happening around this table. And they are for further exploration as well. Back to you, Michelle.
Thank you, Kubra. So as you can see, we've heard a lot of feedback from our community partners around what are those actions that we need to move ahead with. And so to do that, we will continue to collaborate with our partners to implement those initiatives. We will be implementing the multi-year plan for our Building Safer Communities, and that's focused on youth violence, as Kubra mentioned. And really, now that our actions have become a little more clear for us, we do know that there's additional resources that might be required to implement that work. And so we foresee coming back to council to provide that update, and also reaching out to other funders around the community to understand where those resources are available. So that's it from us. We're happy to take any questions that you might have. We also have a few directors here that are supporting this work through Morgenstall and Jessica Chase available.
Thank you very much, Rochelle and Kubra. You did amazing. Well done. And I want to thank you personally for all the work that you're doing on this. But don't go away. There are some questions. Councillor Nan, please.
Thank you, through you, Deputy Mayor, and thank you both for the overview and, more importantly, the work that you've been engaged in at the table over a year now since we last heard the report. So I wanted to ask a couple of questions, one regarding the Building Safer Communities Fund and the community-led initiatives. focusing on reducing and preventing youth violence. Recognizing the program goal of it being community-led, I was wondering if you could shed any light on the initiatives that are being created here and the kind of capacity building that's happening in the community, please.
Absolutely. Thank you,
Rochelle?
through the Chair. So we're actually just at this critical point right now with our Building Safer Communities Fund that we've been working with consultants to understand what this multi-year plan would look like. And so there's 3 key initiatives that we've heard from the community that they want to focus on. One, around expanding and launching more preventative programs to support youth, so around recreation, mentoring. Another being expanding and launching programs that support youth exiting gangs. And then again, around increasing the coordination of services supporting youth in this realm. Those were the 3 key initiatives that we heard pretty clearly from the community, and we will be moving forward with implementing that in the coming months.
Thank you.
Councillor?
Just a supplemental, if I could, through you, Chair. The first one, you mentioned recreation, and did you say something? I missed something. You mentioned exiting gangs, which I got, and the ongoing coordination of services that are available for youth.
The preventative programs
Preventative.
around connecting youth with their community and building those relationships. It might be through recreation programs or mentorship programs, as some examples.
Councillor?
Thank you. I'm really very interested and excited about this realm of work because of, I think, many around this table understanding the unique impact the pandemic has had on young people in our community. And what I hear often in the ward is about, the work that folks are desiring to do, whether it's from a personal mentorship perspective to finding new ways to connect to young people again. And then there's the other side, which is the youth-led what we would like in the community, and I'm really excited to see this work, and I'd love to hear more about it through this committee. I imagine there's also intersections to our youth strategy there as well. The next question I had was about the situational table, which I think is an exciting model. So Kubra, you mentioned through you that the table is convened to come together around a specific type of crisis that either a unique individual is experiencing or somebody within the service sector, I guess, is experiencing. Can you unpack the situational table a little bit more? Because I think it's really important model for us to hear more about. And then again, my question is always about capacity and resourcing that work. Thank you.
Thank you, Councillor. Kubra, please.
Of course, through the chair. And I think there's been a lot of conversation around what is the best model to implement here in Hamilton. There have been iterations of situation tables, I think, in Toronto, in that area over there. But the main goal, I would say, is to bring to one table these stakeholders that have an impact or could influence the immediate situation. And I think, of course, respecting the privacy of the individual, respecting the situation that they're going through as well is another very important part of that, because we can have these discussions at bigger tables, but what implications does that have on the individual are also things to consider. So we are going through these models and looking at what works best and which best practices can be used and implemented here in Hamilton. And so it hasn't yet been convened. Okay. It is in the process of being workshopped. So so I think developing that model and very much honing in on what would work best in the city of Hamilton is what the focus is right now, and seeing how we can bring together stakeholders that could specifically influence that direct situation, especially, again, keeping in consideration the privacy concerns as well as the personal concerns is also a priority.
Thank you. Through you, Chair, I think of the work that often happens with the, I forget the name of the group, but it was on your initial slides, that come together around supporting women who are experiencing violence in our community, and how sectoral partners and community-based partners get together and really collectivize resources and strategies and figure out how to lift a person out of a situation that they're experiencing. So I'm glad to hear this model being used in more ways, and look forward to hearing more about it. My last question would be, through you, given where you are at in the strategy development, Is there anything that you can share with us in terms of the projections you're seeing about the gaps in our community? And yeah, a little bit of foresight, if I could hear it from both of you, around the needs you're anticipating coming forward in 2024. Thank you.
Who wants to start?
Thank you, through the chair. That's a great question, and one that we have brought back to our system leadership table a few times, where we've left off in terms of understanding where resources and what we need to move forward with the actions, is that we have a good understanding of the model in which we want to implement funding. We need some resources internally to support the work, but mostly into the community and reinvesting in the initiatives that are there. So we know that that's the model. In terms of the actual funding that is needed to do that, we're confident that now that we have the actions addressed, that we, and through the working groups that we have established over the next few weeks, that we're really going to get to a place where we can articulate exactly what that ask is. I can't say it right now, but just thinking to the delegation earlier today around safer drug use, knowing that $400,000 is the cost to implement this program, and that is one that we're seeing great benefit in the community, that gives us a sense that there's quite a large number of resources that would need to go into supporting those initiatives further. So we'll get back to you on that.
Yeah, no, I appreciate that, through you, Chair. Just I'm conscious of the need to build with sustainability in mind, and really resourcing the capacity in our community in a way that isn't setting up the replication of what often is experienced in our social service agency and community sector, which is programmatic funding-based existence versus population outcome-driven commitment to true well-being in our community. And so I'm really conscious of that, and I'm excited, even though I'm always wanting this work to happen more rapidly. I understand that it needs to go slowly in order to make sure that that sustainability is a core principle throughout it. So thank you again. Those are my questions and comments.
Thank you very much, Councillor. Our next speaker is Councillor Kretsch.
Hi to both of you. Good to see you. And I just, my questions are really around the gap that Councillor Nan spoke to. Like, I hear about community safety every day. And there's never really a solution, a safe solution to delivering on the promise of community safety. It doesn't exist. And so $4 million is not enough for you to undertake this work over a 4-year period. That's just scratching the surface. And as you know too, some of the funding you've been allocated is specific to like a targeted issue, right? But there's a million issues in community safety that need to be tackled. So based on your experiences so far, and frankly, listen to what we've heard already today, right, about the life-saving services that exist at the YWCA. What we're seeing here is peer-led services, community-led services, supervised obviously by folks who are professionals, but right, like at the core, this is about the community leading its own way forward, and we're seeing amazing results. What do you see here for the community-wide? What kind of service are we missing? Like, where do you see us in terms of record? I know you're, again, at certain stages of this, but like, just from a very broad perspective, you've been doing this work for a year. I'm sure it's come up.
Good question.
Thank you.
Go ahead.
Yeah, thank you for the question. I think there has been, of course, at the system leadership table, but even in a more broad sense, and you know it because you're saying it as well, that these conversations are happening within the community. And I think a lot of what has been coming up is the fact that there are communities who feel as though, especially the voices that they're trying to put forward, are not being heard and not being prioritized in these decisions, and how we decide to go about, you know, these programs and how we go about funding. And I think for me and for a lot of us, the priority is ensuring that we are allowing those voices to shine through, and also use that guidance as a priority for how we would like to implement the different actions that we've outlined. I think, and as Councillor Nan had mentioned previously as well, there are community groups and organizations that are doing this work in very specific ways. And so I think not duplicating what already exists is also very crucial, especially to prevent burnout, especially to prevent, a lack of promotion of the things that are working. And I think just honing in on those specific programs and organizations that are doing the work effectively and providing them with that support to better sort of enhance what they're already doing, I think is very much so an important piece of this work.
Councillor?
Thanks. I guess my other question is, do you see the need, and I guess I'll just biasedly say, I 100% see a need for a kind of fourth service. I'm just going to be very plain about it. Police, fire, paramedics, missing. Like, there's a thing here we're missing, right? To provide that kind of level of response. It's just not there. And I think funding the community safety and well-being plan, part of that, my hope, when I saw this coming at first, I thought I'll be honest with you, very cynical. I was just like, okay, this sounds very buzzword worthy, and seems like it's going to accomplish it. I kind of checked out everybody who was involved and was like, I don't know. But the hope in this for me is that there is going to be advocacy. There's going to be a push for that discussion around like that gap. Because you're right, there are people doing work already, but also this new thing, I think. Also something else. Creation, like also, there's joy and there's something that I'm excited about happening there. Could you speak to that like possibility of what we need to create in order to have safety, like actual safety in our communities?
Thank you, Councillor. Rochelle?
Thank you, through the chair. I think that's really where we see the system leadership table playing a really key role, because with other community initiatives, we have identified what those priorities might be, and we can get working groups to really action and move that work forward. But oftentimes, as you're saying, we need an advocacy realm so that we can ensure that the funding that we need on all levels of government are being pushed and that we can receive that to support some of the work. So I do think that through our system leadership table, there is that broader conversation happening across all the different sectors, and I'm hopeful as well that that's really a place that we can have those conversations and push this work forward. But it really is that collaborative that we need to do this work, because there is so much overlap and so much connection to do things a little differently.
Councillor? 2 minutes, 30 seconds.
Thank you. And through the chair, I appreciate the answer. I think that you're right. I'm glad that in terms of the fact that we need to have a collaborative approach to this, because otherwise we are going to duplicate things. We are going to make a mess of things. We are going to start doing stuff and realize, wait a minute, these folks in the Indigenous community are already doing this thing over here. They were doing it really well for many, many years. Why can't we replicate that thing they're doing here? Expand that idea. Bring the YWCA is doing this unique thing that it's doing here. Why can't we bring those pieces together, I hope, in a comprehensive way? So I'm hopeful that having all these voices around the table will allow that to happen. I really look forward to seeing this come back here. I think the municipality has a role to play in this, as we have a role to play with all of these frontline services. Like, we have a role to play with paramedics. We have a role to play with fire. We have a role to play with policing. We have to have a role to play with community safety as it changes and evolves. My last thing I'll say, and it's just a comment, is that I want to really end on that point, which is that community safety has evolved. We haven't necessarily evolved with it, but it's changed. Our perceptions of community safety have changed, and actual community safety has changed as our community has changed over the last 100 years. But we haven't necessarily developed services, supports, and programs to actually keep pace with that. And that's what I see this program actually doing, is trying to address that issue, trying to fill that gap, and trying to make sure the need is met. So thank you for your work.
Thank you, Councillor. The next councillor is Councillor Wang, please.
Hi. Thank you, through you, Chair, to our delegates. I wonder if you could dig a little bit deeper into what you did in the McQueston neighborhood by saying that you've addressed safety concerns, because I know that there was a couple of initiatives I'd just like to understand a little bit better.
Thank you, through the chair. So the work that happened with our McQueston neighborhood, this is another great example of how we've been bringing different partners together to convene and have some conversations around what are issues happening in a neighborhood. And McQueston, as an example, we're having safety concerns, youth, taking part in acts of violence, and the community not feeling safe. And so we recognized very quickly we needed to come together with different partners, City Housing, Hamilton Police, NOWASA, a few different partners right in our McQueston neighborhood to say, hey, this is an issue that's happening. What can we do to support youth in a different way? And so through that work and the great planning that happened through our senior project manager, Chelsea Kirkby, they were able to really make a program specific to youth in that area. We've mentioned that in the last few weeks, a bowling event to bring youth in and really offer that opportunity to build relationships with adults in the community, to have interactions with Hamilton Police and understand each other from where we're coming from so that we can build a little bit more trust across that neighborhood. So it really was in some events that we moved forward with.
Councillor?
Wonderful. Thank you so much, Rochelle, for that explanation. Chair, I'm a little biased here, but I did hear about the great work here with this particular initiative, both through NOWASA and through City Housing Hamilton. So I will say that it didn't go on deaf ears, so I was really excited to see that this come forward as well. The next sort of line of questioning I'd like to ask to our delegates through you, Chair, is when we talk about a data strategy, and I know you're still in that beginning phases, and I know you're still trying to flesh what that looks like, but what did you envision it looking like as the big, hairy, audacious goal? Like, what is it? Like, what does that look like?
Kubra?
Yeah, thank you. I think there are multiple pieces to the data strategy and collecting data, generally speaking, and I had mentioned the online platform as one of the tools that I think will be very useful in collecting data around community safety and well-being and how residents of Hamilton are experiencing, hate incidents, for example. So I think that's one portion of it in understanding those pieces, but I think as well, a big goal surrounding that data collection or the data strategy is to measure how effective these collaborations are, right? So I think, we can talk about how we are partnering to do these initiatives within these neighborhoods or to address specific issues, but how effective are they really? And I think the model that we're looking for will be able to kind of answer that question, and we'll be able to reach community members and other stakeholders to see whether or not, there has been an effective outcome from these collaborations and programs and projects as well. So I think to answer your question, yeah, the big goal is to really see what the wide array of issue is here in Hamilton, but also to learn whether or not what we're doing is working and how we can change it to make it better.
Councillor.
Thank you. I'm mindful that data is king these days. It's the new oil, it's the new gold. Whatever we're calling it, but data is king these days. I see that many community organizations are leveraging data to help further and essentially backstop some of their programs and initiatives. I wonder, may I offer a suggestion to our delegates to take a look at what Hamilton Police Services, Hamilton Paramedics, they're data rich, and is there an opportunity to potentially have them share some of those findings and learnings? Mostly because when I was talking to the Hamilton Police Services about the McQueston neighborhood, they actually had significant amounts of data around that. So it was mindful, don't recreate the wheel. I think that it's just, a lot of these could potentially be pulled in. My last line of questioning is around the resources that you currently have and maybe the amount of funding that you actually got to even get this started. Where did that come from? And I know you did make mention of the senior project manager, so I just wanted to understand how is this currently being resourced?
Thank you. Rochelle, please.
Thank you, through the chair. Currently, from our June 2021 report that was passed through council, we received approval to hire on a senior project manager, and that is the only resource within our city of Hamilton that is designated to this initiative. And so that is the sole funding that we have from the municipality. As we mentioned, Building Safer Communities is another pool of funding that we've received, and that's the $4 million over 4 years that we were receiving. But that's targeted to youth violence initiatives.
I see, okay.
Councillor?
Thank you. And supplemental to all of that then is, as you're building out all of your different program areas and all of your different collaborations, have you started to dig into what other sources or pots of funds that you might be able to access through this community safety well-being?
Michelle?
Thank you, through the chair. We've started those conversations. We know that there's a model that we would likely align our funding and resourcing to, but we needed to get clear on those actions that we presented today to speak to funders in a way that they can understand what is the outcome for the funding. And so that's where we're at right now, still determining what those sources might be.
Councillor?
Wonderful. And I did hear that you said you had $4 million from one of the federal pots, and it was around youth and gang violence. Through you, Chair, to our delegates, have you connected with Liberty for Youth or any of the other, like John Howard Society or anything like that?
Rochelle?
Thank you, through the chair. As part of the Building Safer Communities Fund, we hired on a consultant to lead the consultation process in the community. And so we did just that. We had an advisory group come together with Liberty for Youth, John Howard Society, NWASA, HCCI. We had many partners come together to inform what that multi-year plan was going to look like. So yes, we have.
Wonderful. Thank you. Those are all my questions.
Thank you, Councillor. Well within your time frame. Okay, next speaker, Councillor Alex Wilson, please.
Thank you. And through the chair, really interested in having a community safety well-being plan mandated via the Ontario Police Services Act, that we have one. And so I think want to talk about like what that comes into later. But first, I just am seeking to understand the 2021 plan that was passed, the 40-page document on the city website. It seems like a lot of work's gone into moving forward on some of these priorities, but also as that work has been going on, as that conversation's been going on, some of those opportunities for action have morphed from an opportunity into a specific outcome or a specific approach. Just from a process work perspective, are there year plans available? Or if I wanted to find out more information about what this group was doing or saw a lot of value, maybe through you or maybe through some of our staff, where do I find that on the city website? Or where in the public, on the public side of this, can folks get engaged?
Who wants to tackle that one? Rochelle?
Thank you, through the chair. Another great question. We, with our community partner workshop that happened in the fall, that has really been pivotal for us to understand where the community is at and where do we need to go based on that feedback. And so we've been really waiting to go through the processes to get the approval from our system leadership table and come to council as well to share what those actions might look like. But I think now we're at a point where we can share more of that information, and we're always open to sharing to whomever would like to hear more about it, and we can look at resources on the website as well.
Councillor?
Thank you so much. And just so I understand, because I think it's both a document that we use within our city to be very useful, but it's also a legislated requirement that we have one. Would that be in the form of potentially an update to the plan and the action items, and we'd be changing and we'd be coming up with a 2023 version, or would we just be posting this is still our plan, these are still our goals, but here's how we're doing on achieving those targets?
Rochelle?
Thank you, through the chair. Our annual report that was submitted along with this presentation is one of the ways that we are reporting back. We are hopeful that when we create that data strategy, that it's the data strategy and the big outcomes that we're looking to achieve that maybe annually would be reported back as well. So we're in the process of figuring that out, I think, still, but yeah, we're looking to do that still.
Councillor?
Thank you. And through the chair, it sounds like a lot of these resources exist, and so I think that's simple enough to get them on a website, so it sounds like a lot of that stuff exists. The reason I'm asking is because I think there's such value in having what our community priorities are when it comes to community safety, documented, articulated, and easily available, specifically when it comes to crime prevention. Yeah. I think we talk a lot about how prevention is where we want to be working. We want to be thinking upstream. We want to be preventing crimes before they happen as opposed to solely responding to them. And I see a lot of prevention pieces in this strategy, clearly like it's identified as crime prevention. And I asked the same question to the HPS when we were having our presentation there about what are their crime prevention actions. And one of the things I heard back was that we're focusing on preventing Facebook Marketplace style theft or scams by having some of those pieces of crime prevention, but that's not necessarily a priority in this community safety well-being plan for prevention. And so I guess I'm wondering what that interplay is like, given that the HPS is part of the steering committee for this, but we have kind of two groups in town who are identifying prevention priorities. Could you help me, as someone who's interested in advancing prevention, understand what are the priorities? How do we understand them, and where do those relationships come together?
I can start off.
Kubra?
Thank you. Yeah, I think there needs to, of course, be that conversation around, who's tackling what and what conversations need to be had on these specific topics. I think the priority, of course, for this committee is community safety and well-being. And, you did outline the Facebook Marketplace example, and I'm thinking, what were the priorities that were outlined during 1 hour conversation with community partners at the workshop that we had back in November, but also when we have these discussions around, an implementation plan and, priority areas, for example, the ones that we've already outlined. I think, HPS has its own role to play in the community right now, but I think the focus here is also seeing how other stakeholders and other community groups and members can come together to address these issues as well without necessarily, doing that through a policing approach. Whether it be, individual community groups that are bringing about these ideas around the table, or whether it be a collaboration between members of the table as well. So I think it's very much so about prioritizing community safety well-being, but also doing that in a way that is community informed with these specific stakeholders and seeing what the priority areas that they've identified in their community is most focused on, and how we can kind of address those in that way. Hopefully that answers. I don't know if you have anything to add.
Yeah, through the chair, I think that does provide an answer. Back before in 2021, there was over 2,000 people that engaged in the process, either through Engage Hamilton or through other feedback. It sounds like there's been even more engagement in the fall, and so there's been a lot of community work and input and time and energy put into this provincially mandated plan under the Police Services Act to detail what community priorities for community safety and well-being, including crime prevention, are. And so my question is just very explicitly, if I was saying I want to increase our funding as a city into crime prevention, would you recommend looking at the community safety well-being plan as an authoritative source on where some of those needs are?
Yes, through the chair. I definitely would. I think, talking about crime is very complex, and I'm not a criminologist, so I don't want to go in like the root causes of everything. But I think, when we think about the crime that is going on in community, a lot of the time it's crime related to people who are unable to access specific resources, people who haven't received supports in different, life aspects that unfortunately, that escalates and turns into situations that they can no longer prevent, and they get, involved in the criminal system as well. So I think, when we talk about crime prevention, policing, I think, is kind of further down the spectrum. Like, what are we doing to really focus on these groups and organizations and initiatives that are working with community to ensure that these needs are being addressed and that they feel safe and as though they belong to a community, which can prevent these acts as well. So I definitely, yes, I would say so. And I think that the community safety well-being plan and the groups around the table of this plan as well are very much, great resources to look into because there are youth programs being offered, there are, community programs being offered, and they are doing the work to create safer communities, in and of themselves, right? So I would, long story short is yes.
Councillor?
Thank you, and through you, Chair, switching gears a bit, and I really do appreciate that answer and, the intricacies of that answer as well, and in giving it. And so switching gears, I know that supporting community-led initiatives, that might not have been the exact phrasing on the slide, but supporting community in doing this work is one of the priorities for this year. Going back to the 2021 plan, one of the red category, I believe that was like response, responding in the moment, was to review and evaluate COAST and other similar programs. Do you see a connection between that identified action in the 2021 plan and this priority of community engagement? Do you see those two things going together this year?
Rochelle, please.
Thank you, through the chair. Yes, we do, through our next steps in the working groups that are going to be coming together, we'll be doing just that, really taking a scan of what's existing, what do we need to invest in. There's also the system mapping work that's underway, and we're really hopeful that that's going to provide a little bit more information in terms of what's existing and those gaps. So yes, we'll be taking that information along with a lot of other information to make some decisions.
Thank you.
Councillor?
Through you, Chair, just a last question from me, and it's okay if that's, may not have an answer, but I just When I look under the adequacy and effectiveness of policing services Ontario regulation, which specifies that our HPS has to fund and has to work within crime prevention, it says that police forces shall provide community-based crime prevention initiatives, and then right after it says, instead of having police force provide community-based crime prevention initiatives, a board may enter into an agreement with one or more organizations other than police forces to have organization or organizations provide crime prevention initiatives under the direction of a member of the police force. When you're identifying some of these priorities for community-based crime prevention, has there been a conversation about funding that through exactly this, the HPS, or some of those, because they're at the table, they're part of that? I'm just trying to understand if we have documented priorities when it comes to crime prevention, how we're moving forward on those in all the ways we can.
And that's your time, Councillor. Rochelle, please.
Thank you through the chair. Those conversations are underway, and we know that with the Hamilton Police being at our system leadership table, that they are open to those conversations. The more specific we can be in terms of what those investments might look like will be helpful for us to retain that. But they are partners, and they are open to those conversations.
Thank you very much. Councillor Tom Jackson.
Thanks very much, Chair Clark, and good to see you, Rochelle, and Kubra, nice to meet you. I'm really encouraged by the questioning and more importantly, the answers regarding Hamilton Police Services involvement. I know that last term when I was honored to be on the board and Chief Bergen had won the position to become our police chief, one of his first initiatives was to be at the community and well-being, community safety and well-being plan table in every aspect of bringing Hamilton Police Services perspective and support and participation to the table. Let me just ask you both bluntly and directly, is the Hamilton Police Service representation and participation what you've expected it to be up to now, or is there a part and parcel for them to play down the road? Give me some further description and explanation and elaboration on the police services involvement with the approximate 1,700 stakeholders you said, Rochelle, were at the table. Through you, Chair Clark, please.
Thank you, Councillor. Rochelle, please.
Thank you through the chair. We had the Community Safety and Wellbeing Plan join our division in the fall. And so it's really been our work to understand what the partnerships have looked like and where we could move forward. I can speak to that time moving forward, and the Hamilton Police have been very engaged. They are looking at different ways that we can support initiatives. So we're thankful for that. And there's examples through the hate crime case review team that they're leading, but wanting the Community Safety and Wellbeing Plan to be a part of that, as well as other community partners. So we are working together to think of different solutions.
Very encouraging, Rochelle. And I know the police's desire is to move from incident response to risk interventions as much as possible. And I take it that's an ultimate goal as well, Chair Clark, for the Community Safety and Wellbeing Plan and yourselves as leaders, Rochelle?
Rochelle.
Thank you through the chair. Yes, it is. We certainly are trying to focus as much of our initiatives on preventative, proactive strategies. And so we would align with those opportunities in the community as well.
Excellent. Just to close, again, from the policing standpoint, Chair Clark, in spite of what some people may feel, police and policing is always much preferable in terms of crime prevention versus crime reaction. But sadly, unfortunately, in many instances, they are the ones to react to try to resolve a matter and or arrest the perpetrators, especially involving any form of violent crime. But this is all great news and very encouraging for our community, and especially in the area of youth violence. It's an area that is not only a real problem, but a perceived problem, especially amongst those that may be elderly as well. Thank you, Chair Clark.
Thank you very much, Councillor. And once again, thank you very much for your presentation today. It was most enlightening, and appreciate all the work that you've been doing for the City of Hamilton and all of our residents. Okay, I need a mover and a seconder to receive the presentation. You can have a seat now if you wish. Moved by Councillor Alex Wilson, seconded by Councillor Tammy Wang. This is to receive the presentation, and then we'll be receiving the report. That vote carried 7-0. I need a move and a seconder to receive the report. Moved by Councillor Maureen Wilson, seconded by Councillor Narinder Nan. Sorry, we'll cancel the vote. Councillor Maureen Wilson, please.
Thank you, Chair. I really enjoyed the delegation and the thoroughness of the answers and great questions. Just to opine a bit, is as an advocate of public health and an approach to upstream funding, it is, I'm sure it is exhausting, though, for community groups to have to consistently document and gather and talk and justify, harm, trauma, circumstance. And I hope and trust we get to a place in our funding and our policy and in our approach where we see the value of the individual, where we particularly see the value in the circumstances that go in to maybe eliminating choice, influencing choice. So we get to a point where we're really identifying real community safety and well-being at the earliest start of life. For me, that begins in maternal health. It means talking about social determinants of health, which include housing security, income security, race, gender, all of those things. So I up for this journey, but I think Councillor Nan used the phrase, we would like to get there sooner. Thank you.
Thank you very much, Councillor. So now we'll have that vote. And that carried 7-0. Okay, we are now moving on to the consent items. Madam Clerk, may I have a mover and a seconder to receive the information report? Lisa Maychuk, project manager, is on hand if there are any questions. This is the seniors strategy update. Correct? Councillor Jackson?
Happy to move it and like to ask a couple of questions.
Certainly. And seconded for Councillor Wang is seconding. The items on the floor. Go ahead, Councillor.
Thank you, Chair Clark. This sounds like a really good move within the department. So through you to General Manager Angie Burden, I read in the initial paragraph on page 1 under information, the City of Hamilton's senior strategy has evolved over time, currently includes the age-friendly plan, Senior of the Year Award, Seniors Kickoff, staff liaison support for Seniors Advisory Committee, and in January of this year, the senior strategy transitioned from the Children's Community Services Division to the Long-Term Care Homes Division to better align the work that the City of Hamilton is engaged in to best serve the needs, priorities of older adults living in Hamilton. So, General Manager, I take it this was a departmental move and maybe just some further elaboration on it. Through you, Chair Clark.
Thank you. GM Angela Burden.
Thank you. Angie Burden, General Manager of Healthy and Safe Communities. Through you, Mr. Chair, to the Councillor. Yes, we're quite excited. If you remember, there were a couple of, in a recent report, Council did give the approval for division leads and the general manager in Healthy and Safe Communities to review alignment of programs emerging out of COVID and where it made sense to achieve alignment. I would say that this is an example of one of those decisions where it has made sense. The lead for the senior strategy and the age-friendly plan under Lisa Maychuk had previously been under Jessica Chase in Children's and Community Services. Some excellent work being done there. But I'm wondering, Chair, through you, if Holly O'Doherty is also online and could have a few minutes to share some of the vision there to further and better explain some of that alignment that is happening right now.
Thank you. Manager O'Doherty, please.
Through the chair, Holly O'Dwardy, Senior Administrator for Macassa and Wentworth Lodges. Thank you, Councillor Jackson, for your comments and questions. This is really exciting for the senior strategy to be realigned with the long-term care homes. We do serve older adults in our 2 homes, so the work that we're doing, we do see alignment with that supporting our community at large as well. In the report, you would have seen one of the elements that we're working on in our age-friendly plan, our equity, diversity, and inclusion work, and we're working on that with our Greater Hamilton Health Network team. So I heard a councillor earlier talk about, is there opportunities for collaboration rather than duplication, and that's what we're doing. So we know that the Greater Hamilton Health Network has established a framework, and so we are going to be working with them to establish the same or similar framework with our age-friendly plan. And part of the age-friendly plan is our long-term care homes, 27 of them in our city of Hamilton, that are doing a lot of the work that is embedded in that plan. So lots of alignment, and excited for this collaborative nature between Seniors Friendly and our LTC division.
General Manager Burden, thank you, and Senior Administrator O'Dwardy, thank you very much. I want to remind my colleagues in the community that I believe Hamilton was one of the first cities in the province of Ontario to develop and adopt officially an age-friendly plan, and very, very proud of that for seniors. Supplementary question, Chair Clark, through you to Senior Administrator O'Dwardy. On your page 8, just supplementary to your EDI comment with the long-term care homes and initiatives. So quickly, and for some of my colleagues that may have not been aware, I'm going to guess, Holly, about 25 years ago, you may recall with your predecessors that were in your position, but real quickly, I remember there was an element of the Canadian Japanese community in the city of Hamilton that lived on the mountain, many of them living in my ward, that were desiring, if you will, a section of one of the wings at Macassa Lodge as a block where they could, because of language issues, cultural issues, familiarity issues, could be together. If I recall, maybe 20, 30 families. And the administrator of the day, with council support, provided a section within that particular wing at Macassa Lodge for the Canadian Japanese families to be together. It just provided them a wonderful security, safety, peace of mind, and familiarity with each other, of course. Is that the type of thing? I'm wondering how many different ethnocultural racial languages or diversities currently are at Macassa Wentworth Lodge, and is that the type of thing you're referencing here on page 8 in terms of what we accomplished successfully 25 years ago? Is that kind of the direction you'd like to go in again, or is there something I'm missing? Through you, Chair Clark. That's my last question.
Thank you.
Through the chair to Councillor Jackson, that's exactly elements of the equity, diversity, and inclusion that we're working on. So that really talks about person-centered care in community or in long-term care, supporting equitable and respectful care. And so I did start here in Macassa in 2003. Councillor Jackson, your memory continues to astound me. And we did have on E1 and E2 a large Canadian Japanese-based population. And we continue to have the supports through that programming to today. And so they do continue to support our residents, Japanese Canadians, or anyone who chooses to participate in that programming. They come in weekly. And I know that you do pass by here, but the cherry trees out front of Macassa Lodge were a donation from the Japanese consulate as to the work that we did with their residents. So we continue that work, proud of that work, and that's exactly what we're speaking about. Between both Macassa and Wentworth Lodges as examples, we have over 25 different cultures that we support and serve. We work with residents and families to do our best for that person-centered care. And in terms of languages, we have residents that speak over 17 different languages approximately from my last recollection.
Outstanding. Chair Clark, we're in excellent leadership hands with General Manager Burden and of course, Senior Administrator Odiarty and the seniors strategy. The whole alignment of what General Manager's done, it just spells for even more successes down the road in terms of looking after supporting our seniors community across our city. Thank you, Chair Clark.
Thank you very much, Councillor. Councillor Wang, you're up next.
Thank you. Through you, Chair, I'm not sure who I would direct this to, but I want to say that this senior strategy is very fulsome and there is a lot of points in it. However, I find that there is one giant point that may be missing, and that is looking at cost and affordability for seniors. What I have heard most recently, specifically as it relates to our passing the budget, that many residents in Ward 4 are on a fixed income. They are seniors. I would like to ask, have we considered as part of the senior strategy some level of financial funding or resourcing to help seniors with accessing government grants or some sort of, just some way of helping them with affordability? Through you, Chair, and I'm not sure who to direct that to.
Let's try GM Burden first.
Thank you. Angie Burden, General Manager of Healthy and Safe Communities. Through you, Mr. Chair, to the Councillor. I think we could, there's a combination of programs. So for example, through our Ontario Works and ODSP, there's a certain eligibility criteria by which we would be assisting low-income seniors. I'm wondering if Director Baird could speak from of any programs available through housing services. Again, there are examples.
Are you there?
I'm here.
There you are.
Yes, through the chair. So we do have some programs that do support individuals with affordability, not specifically to seniors, but seniors are of course eligible to use the programs. So some of those programs would be things like our housing stability benefit. We have a rent arrears program. We have programs that help with utilities overall. And so all of those really are available to tenants to support them to stay in their place of residence. My fire alarm is going off in our office and I need to check off.
Why don't you vacate the premises?
Yes. Thank you. Thank you, GM Burden, and to Director Baird. I'm also mindful that we were talking yesterday about the Climate Change Office, and of which one of the programs that they are aiming to roll out is the HERO program, which is the homes, something retrofit, something energy retrofit. I'm thinking about how our seniors could definitely benefit from that, and is there an opportunity to explore how we can put some sort of option aside? Because I'm also mindful that some seniors are also interested in improvements to their home, be it grab bars for their toilets and bathtubs, be it mobility, accessibility ramps throughout their home, and those all cost money. And I know that there are government programs that may help with a portion of it, but perhaps they may not have the resources or the idea of where to find that information. So I'm not sure if I should be passing this as a motion to direct our staff to also include that level of detail into the senior strategy, because I feel that as a public document, this will live on our website and it'll be a first source of information for the seniors, and that way they can see how this moves forward. But I'd like to direct that to GM Burden to see if that is within scope, or if that is absolute, if it's necessary to pass a motion. I'd like to just get some thoughts around that through you, Chair.
Councillor GM Burden, thoughts?
Thank you. Through you, Mr. Chair, to the councillor. So what you're identifying, Councillor Huang, is part of the reason why we have made the change structurally for the senior strategy, and for Holly to be really looking at not just being within the realm of long-term care, but looking at the senior strategy across Hamilton in general. Part of her vision is to really re-engage the community in terms of broader representation and to be looking at some of these things. To your specific example, for example, can we make information more available in a more accessible way, in a more coordinated way? Can we have more single portals for that kind of information? So my sense is that Holly has appeared on screen and may have a few points to add here. I don't necessarily think that a motion is required at this point, as we're really looking at a new way of working within the seniors strategy within city government.
Holly?
Through the chair to the councillor, great question. And the 7 strategic goals that we have with the age-friendly plan will really help to draw out that type of information and support for our seniors across the community. I see that Lisa Maychuk is on the call. The work that Lisa has done, may I say, only one person being responsible sort of for 30% of our residents in Hamilton has been absolutely amazing work. And so I'm catching up with the work that she's been doing and leading, but there's been a lot of stakeholder engagement with older adults on what their needs are to support them. And so Lisa, if you're there, if you're able to speak to a few of the works that you've done with the stakeholder engagement around these, and I think that the health and community services goal and the housing are elements that our councillor is asking about.
Thank you. Lisa Maychuk, please.
Lisa Maychuk, Project Manager, Age Friendly City, through the chair. So I think this report is just sort of an overview of what the senior strategy is. It doesn't really dig deep into some of the progress we've made over the last, I guess close to 10 years now. The first Age Friendly plan was initiated. So directly to your question, we know that that there's a huge problem right now with many residents, but specifically seniors, being able to continue to live where they're living, with prices rising. Their pensions aren't rising. They're not able to, if they own their home, not able to stay in their home. It's basically, should I pay my taxes or should I eat? It's a huge problem right now. So what we're working. One of the things we're working on right now is developing a housing guide that not only will talk about various types of housing, but will also speak to things like housing benefits, financial benefits, so that they can continue to stay in their home and still enjoy life. Age in place, I guess that's sort of the term, or that's something that we aspire to. So when you mention home adaptations, that's one thing that many older adults need as they age. So Ontario Renovates is a benefit that is funded by the province, but is administered by the municipality. And I don't know that many older adults, and many are on low income, receive low income, or have and can benefit from that program to help, install grab bars or any other type of adaptive device that they need to continue to age in place. So I think this guide that we're working on, and when I say working on, it is a collaborative project. It is myself working with the Seniors Advisory Committee, who are older adults themselves, and staff in our housing division. That's the only way we can get a lot of this work done. We do, and I know I'm kind of going on a little bit, we don't have a lot of money for the senior strategy. We really rely on collaboration, and our 2 key partners, the Hamilton Council on Aging and Seniors Advisory, have done a lot of work over the last close to 10 years now to move the recommendations forward in the first plan. As well as now we're into our second plan. I can think of a project that took place in the first plan. It was developing these brochures on home adaptations. So there were 3. One was for residents who were renters. One was for homeowners who were older adults, and one was for property managers, and basically educating them on, if you have an older adult, these are some of the things that you need to do for your tenants. So there has been some work. We still need to do more work. But yes, I agree with you wholeheartedly that older adults need to be more aware of the benefits that are out there for them. And that's why, one of our goals, which is information and communication, is an area that we are constantly working on. How do we get, and not just in regards to financial supports or any other benefits, but just how do we get information out to older adults, especially those that are socially isolated.
Thank you, Lisa. Councillor?
Thank you, Lisa. I wanted to actually pick on one point that you had made about aging in place. Through you, Chair, I wonder if Lisa could also expand a little bit more on perhaps working with Hamilton Health Sciences or the paramedics, because aging in place is something that they speak about quite often, and it is also a big part of how they service the community. So I wonder if there's any type of collaboration that is working with those particular groups as we are talking about aging in place.
Lisa, would you care to speak to that?
Absolutely. We've actually we've just brought on board the Hamilton Paramedics, the community paramedicine program, because we know that the majority of visits they make are to those age 55 plus. So it's a natural fit. They're actually we've got Commander Brett McLeod on board. We actually in our governance committee we've got Russ Crocker, and already our seniors advisory committee has asked that they receive a presentation at their next or at one of their near future committee meetings. So no, we're definitely on board with that. Through the Age Family Collaborative, the Council on Aging has done a lot of, worked on a lot of projects with McMaster University. One is the Embolden study. I can think of that one. We did a number of projects on with rehabilitation science on, basically being safe when you're crossing the street. We had gait assessments done on all our participants. And these are just a few samples of some of the collaborations and projects we've worked on. But what we're trying to do as a collaborative is really expand it. So where it started from a small group of community stakeholders and city staff, and the three key partners being the city, the Council on Aging, and Seniors Advisory, we've expanded that greatly now. On our collaborative committee, we have several city staff from various areas of the city, but we also have a lot of community partners sitting at the table that provide direct service and programs to older adults in the community.
Councillor.
Thank you. I'm also enthused to hear that there is so much collaboration in the community. Immediately, my mind goes to some of the innovation and technology companies that are working on serving the aged in our community, or there's big research firms or research areas like McMaster Institute on Research on Aging. So I'm really excited to hear that. So again, I'd like to just drive home the point that I would like to see more information on resources and different grants and programs that can serve the aging population, specifically because it's really hard to find that information. I know because I've been trying to find that for some of my residents. And then two, I would like to see a greater collaboration with some of the community groups like Hamilton Health Sciences, like paramedics, on collaborating with their programs as they are developing community-based outreach for seniors and aging here in Hamilton. Thank you.
Thank you very much. Seeing no further questions, I believe we already have the mover and a seconder. So if we can have that vote, please. And that vote carried 7-0. Now we're moving on to the advisory committee minutes. A is the LGBTQ Advisory Committee minutes for February 21st, 2023. B is the Hamilton Veterans Committee minutes, November 29th, 2022. C is the Hamilton Veterans Committee minutes, February 28th, 2023. May I please have a mover and a seconder to put the recommendations on the floor? Moved by Councillor Kretsch, seconded by Councillor Alex Wilson. And we require a vote for that. Thank you. And that carried 7-0. So now we're dealing with item 10.1, Madam Clerk, the Behavioral Supports Ontario Initiative / Macassa Lodge HSC 23011, Ward 7. May I have a mover and a seconder to put it on the floor? Moved by Councillor Tom Jackson, seconded by Councillor Alex Wilson. Is there any questions with regards to this report? Councillor Tom Jackson, please.
Thank you, Chair Clark. The title of the report is Behavioral Supports Ontario Initiative for Macassa Lodge. I had not heard of this initiative before this report, so through you to General Manager Angie Burden. This sounds like a new program. It sounds like the province, because the funding is coming from the province, it sounds like the province has possibly chosen Hamilton and our exemplary Macassa Lodge, or maybe other municipalities and other LTCs across the province. So maybe some explanation on the program and the wonderful news about Macassa Lodge being part of this. Through you, Chair Clark, please.
Thank you, General Manager Angela Burden.
Thank you, Angela Burden, General Manager of Healthy and Safe Communities. Through you, Mr. Chair, to the Councillor. It is an exciting, very much needed enhanced level of service for our residents, and Holly O'Doherty is on the WebEx to be able to provide a bit more detail.
Terrific. Thanks, GM. Holly, anything more about this? Is this something the province chose us, or are we one of several across the province? Through you, Chair Clark, please.
Through the chair to Councillor Jackson, Behavioral Supports of Ontario has been in place for approximately 10 years, and they really support long-term care homes and communities with residents with responsive behavior. So those are residents who have some type of cognitive impairment who do not respond to situations well due to their cognition. And so with this particular example, Ontario Health West did reach out to Macassa based on some criteria of increased responsive behaviors noted to be in our home. There were 9 homes in the HNHBB that were selected, and Macassa was one of them. I, of course, did ask if Wentworth Lodge could be also a recipient of this funding, but at this time they were not, but they will continue to monitor that for future funding. And we're excited. So the ask today really is for an FTE to match the financial contribution from Ontario Health West. There is a small administrative cost of $1,700 that the Ontario Health West will not cover, and we're looking to realize that through gapping in 2023. And this is for ongoing funding from the province for this therapeutic recreation position to support our residents with BSO supports.
That's outstanding news, Senior Administrator. And so this permanent recreational therapist will be a permanent part of the staff complement at Macassa Lodge. And the funding, looks like 99% of the funding, except for the small amount of the $1,700, will continue in perpetuity on an annual basis as long as we're part of the initiatives program. That's my last question. Through you, Chair Clark.
Thank you.
Through the chair, that's our understanding with our meetings with Ontario Health West and BSO.
Well done. Further puts one of our 2 long-term care facilities further on the provincial and national map. Thank you very much, Chair Clark. Good work, Holly. Thank you.
Thank you. Councillor Nan, please.
Thank you. And through you, Chair, thank you for this report, and glad to see some support coming in from the provincial government regarding behavioral supports. For Mikasa Lodge, I just had a quick inquiry as, my personal situation has me tuned into senior mental health issues with much more care and attention than I have to admit that I did before, which was much more generic. So from this perspective, if I could to you, is this the only position that is specific to behavioral supports? I imagine we have supplemental staff in the lodge as well, and just mindful of workload and the support that this individual will be giving to potential large cohort in the lodge. Thank you.
Through the chair to Councillor Nan, thank you for the question. So I would suggest that 80% of our residents in long-term care have some type of cognitive impairment, and we do see responsive behaviors. We do annual training with our staff to support our residents with that. This particular resource is to help with those residents that have significant responsive behaviors that almost require one-to-one to avoid an ER transfer of some sort. So they're trying to look at homes that are sort of accepting residents that have more significant responsive behaviors. We're trying to deal with them through our physicians, through our programming here. And this is an additional resource to really enhance that support that we're offering in the home. And typically there is another program through the ministry called High Intensity Needs that you can have a one-to-one with a resident where there's a 95% split with the Ministry of Long-Term Care where they will pay for 95% of the cost of the service provided through our home, typically PSWs, and 5% is absorbed by the home. And so we do use that when required, but this is an additional resource for those that are having more advanced responsive behaviors at a given time.
Thank you. Great news for the residents in the lodge. Thank you.
Thank you. And the next speaker, Councillor Wang, did you wish to speak too? Nope. Okay, we're good. Thank you. So we have moved the motion, and now we need to have the vote. Okay.
Through the chair, that vote carried 7-0.
Thank you very much. Now it's 11.1, which is my motion, Madam Chair. So Councillor Wang, if you can take the chair, please.
Yes. Councillor Clark, please introduce your motion.
Thank you very much. And I'm just pulling up the most recent reiteration. I do need a seconder for it. So I think we should probably read it into the record if everyone can follow along on that, or do we have it on the screen now? I did send it to the last copy to you, Lorraine. Yeah.
I did see that Councillor Alex Wilson is interested in seconding your motion.
Thank you, Councillor, much appreciated. So I'll start by doing the resolved as opposed to getting into all of the whereases. So now therefore be it resolved that the mayor formally issue 3 separate declarations of emergency in the areas of homelessness, mental health, and opioid overdoses / drug poisoning. And I took out that section. If you can go down, that's okay, right there. Perfect. And so it says there, as per the procedure outlined in the emergency manager, and so we need to remove that because this is now more of a government relations process rather than that. Thank you very much. That the mayor send correspondence to the provincial government requesting that action be taken on the 8 measures proposed by the Association of Local Public Health Agencies, including creation of a multi-sectorial task force to guide the development of a robust provincial opioid response plan that will ensure resourcing, policy change, and health and social system coordination. B, expanding access to evidence-informed harm reduction programs and practices, including lifting the provincial cap of 21 consumption and treatment services CTS sites, funding urgent public health needs, and scaling up safer supply options. Revision of the current CTS model to address the growing trends of opioid poisoning among those who are using inhalation methods. Public health, so that portion there where it says public health and social services needs to be deleted. Thank you. D, expanding the access to the opioid agonist therapy for opioid use disorder through a range of settings, example, mobile outreach, primary care, emergency departments, rapid access to addiction medicine clinics, and a variety of medication options. Providing a long-term financial commitment to create more affordable and supportive housing for people in need, including people with substance use disorders. Addressing the structural stigma and harms that discriminate against people who use drugs through provincial support and advocacy to the federal government to decriminalize personal use and possession of substance and ensure increased investments in health and social services at all levels. And G, increasing investments in evidence-informed substance use prevention and mental health promotion initiatives that provide foundational support for the health, safety, and well-being of individuals, families, and neighborhoods beginning from early childhood. And H, funding additional and dedicated positions for public health to support the critical coordination and leadership of local opioid and substance abuse strategies. Number 3, that the mayor send correspondence to the Minister of Municipal Affairs and Housing requesting action to be taken to correct the funding allocation model for homelessness based on the results of the Auditor General's 2021 report, which found that provincial funding in this area is incorrect. That the mayor send correspondence to the Minister of Health and the CEO of Ontario Health requesting that the province immediately commit to fully funding gaps in mental health service as well as funding ongoing annual increases as required by inflation and population need. I think we needed to remove that portion for the Niagara Ontario Health teams. That's correct. Yeah, no, remove that by now. We're not dealing with that. That's correct. Nope. Go back to as. Okay, delete that. And I thought there was something else in there. Thank you. As have been identified in the needs-based planning project. So this was a project that was completed by Niagara Public Health. They did an excellent job, but that's not a part of our letter here. That the mayor send correspondence to the Federal Minister of Justice and Attorney General David Lametti and Federal Minister of Health Jean-Yves Duclos, reaffirming. Nope, that's not correct either. So delete reaffirming Regional Council October 22nd, 2022 motion. Correct. Delete that. Urging the federal government to convene a task force to explore the legal regulation. That's all correct. Number 6. If I'm missing something, please speak up, guys. Oh, yes, thank you. There have been so many amendments to this. Thank you very much. And then item 6, which is the last paragraph, that the mayor send correspondence to the AMO requesting the targeted advocacy be conducted in these areas, including the development of a singular motion that can be ratified by municipal councils across Ontario, calling on the province to take immediate action. So I do want to thank Regional Councillor Diana Hewson, who shared the gist of this entire motion, which came from Niagara. She had heard that we were talking about declaring an emergency, and she was gracious enough to send this to us. In conversation with a few of my colleagues around the province, it would be ideal if there was one motion that everyone could adopt and say, here's the situation. But the reality is, no matter how you slice it, we have an emergency in homelessness. When I visited those emergency shelters and talked to the staff and heard from them how many times they were turning people away because we had no room. The challenge with the local economy will only mean that there will be an increase in homelessness, not a decrease. And if we do not tackle it from both ends of that continuum, we need supportive housing. If we do not have supportive housing beds, we have no place for the residents who are caught in the emergency shelter system to go. And so it just becomes this vicious cycle in and out the door. And so we need it at the other end, but we also need additional supports for those emergency shelters because we may not always have the beds at the other end. With regards to the opioid addiction, I was so impressed with what we heard today from Mary, but I heard similar things from folks at the Salvation Army and folks at Mission Services, where again they were providing those types of services, and their biggest concern was drug poisoning that is occurring, and that's why it's been amended again in here, not just the opioid crisis, but the opioid/drug poisoning crisis. We are saving people because of the work that is being done in those agencies, and we need to thank them for that. And then the last issue is the mental health issue, and everyone I've talked to, every doctor, they're all saying it is a crisis because they don't have sufficient beds in the hospital. The hospital is releasing patients into the community and basically saying, here's your cab fare, but there's no place for them to go. There's no supportive housing. So where do they go? And so they get caught in being on the street. And they don't get the supports that they need when they're on the street. And so then they need to get into supportive housing. It's just a vicious cycle. And it's frustrating from my discussions with numerous colleagues of mine in other municipalities. They're seeing it too. It's not just a Hamilton issue.
Right.
So I unabashedly took the language from the Niagara region because they did an excellent job on it. They pulled into it the recommendations from Alpha. And from my perspective, we have to do something. And I know that some were perhaps a little bit uncomfortable about declaring it an emergency, but I don't know how else we get the attention of the provincial government. We need to continue to do the advocacy work that we're doing, but up till now, we're not having a whole lot of success. And so this is, I guess, what I'm suggesting that we do, and I'll leave it to my colleagues for comments, any amendments, any changes, any reticency. Please share it with me. Thank you very much
Thank you,
for the
Councillor.
opportunity, and I thank my colleagues.
Thank you, Councillor Clark. Are there any other comments? I can't see the thing. No comments? Okay.
Nope.
Oh,
I
sorry.
think it's thumbs up.
Thumbs up? Okay. Sorry. I'm
We have been working on this with the mayor's office and everybody, so the last minute changes, I apologize.
Wonderful. All right. So with no comments, may I call that to vote, please?
Through the chair, we'll do the first vote on the amendment.
Oh, right.
And then the second vote on the motion as amended.
Right. It's in the notes exactly, too. So may I call to vote on the amendments, please? All right, the vote is up.
There it is.
And that carries 7-0. And let us call to vote again on the motion with amendments. Again, I guess same mover, seconder. Vote is up. And that carries 7-0. Thank you. Now, Councillor Clark, I think it's back to you.
Thank you, Councillor, and thank you to my colleagues around the table. So now we're moving on to general information and other business. May I have a mover and a seconder to put the recommendations on the floor? Moved by Councillor Cretch, seconded by Councillor Wang. Any questions about changes to the OBL? Councillor Alex Wilson, please.
Just what are the new due dates for the 4 items requiring new due dates?
We're trying to be more open-minded.
Through the chair, I currently have a new due date for 23G, which will be August 2023.
I'm sorry? GM Burden. Thank you, Councillor.
Thank you. Angie Burden, General Manager of Healthy and Safe Communities. Through you, Mr. Chair, to the councillor's question, we are still looking at dates for those items requiring new due dates, and we'll have something back by the next meeting. There has been just some ongoing pressures in housing, and has been challenging for us to pinpoint and don't want to commit, but we'll definitely then by the next ECS meeting have committed dates for those. Thank you.
So how do we proceed, Madam Clerk? Do we proceed only with 23G?
Yes, so we can, what we'll do is vote on the amendments to the OBL as amended.
Thank you. I like how she thinks. We'll call that vote now. That vote's carried. Any additional new business? Seeing none, may I have a mover and a seconder to adjourn the meeting? Moved by Councillor Cretch, seconded by Councillor Alex Wilson. And I'm assuming that's going to pass. There you go. Thank you, everybody.